Sure, I think that's a question that we're all facing, and no matter which spectrum of healthcare that you're in. And the pharmaceutical world certainly has changed with the evolution of medications and price points that we could not even fathom years ago. And the numbers found in shock even the most seasoned people that are involved in healthcare, let alone the general public. Having said that, though, the general principle of pharmaceutical care must still apply, meaning really we always want to make sure we're getting the patients the right medication at the right dose at the right time. And that overarching policy has to always prevail no matter what the price point is. Really, when you look at managed care policies and processes, things maybe don't need to change necessarily with the policies and the processes as much as really starting with, number one, looking at rate setting, making sure that you're really estimating what the cost is going to be to cover the care, and whether it's in a government space in a Medicaid program or looking at a Medicare program or in the commercial space, really being sure that you're understanding what you're going to be up against as far as how you're going to cover the care. And so if you do that from the outset, policies towards medication should really always follow the clinical practice guidelines and the experts in their field of medicine so that they can yield the best care for patients. I think there's some other things too, other sound measures that managed care can take away from these high-cost drugs. It's really looking at your formulary benefit configuration, making sure that you know you're going to have to cover these high-cost, expensive drugs that are for unique disease states. So making sure that you make smart choices in regard to other drugs where you have many classes of Me Too drugs or you have many classes that have generics available. So really making smart benefit formulary configuration choices. And lastly, an integrated care model, always being sure that if we are going to have to pay for these high-cost drugs, that members have access, members don't face barriers that can then in turn cause an increase in costs in other areas such as ER or hospitalization. So I think looking at all three of those principles, if you will, really are what managed care plans need to do in the face of such huge skyrocketing prices of drugs. I think sometimes we look at cost savings in too simplistic of a manner. Oftentimes it's just cost savings is looked at as a sense of simple math, or cost savings is looked at, for example, just needing a formulary change or a policy change either to restrict or exclude a benefit or put a benefit configuration technique in place or utilization management technique. But pharmacy and medical directors really need to think about how paying for a medication and allowing proper access will improve compliance, adherence, reduce bleeding, which ultimately translates into less emergency room visits, less hospitalization, better outcomes, and overall lower costs. I think sometimes we look at cost savings in too simplistic of a manner. Oftentimes it's just cost savings is looked at as a sense of simple math, or cost savings is looked at, for example, just needing a formulary change or a policy change either to restrict or exclude a benefit or put a benefit configuration technique in place or utilization management technique. But pharmacy and medical directors really need to think about how paying for a medication and allowing proper access will improve compliance, adherence, reduce bleeding, which ultimately translates into less emergency room visits, less hospitalization, better outcomes, and overall lower costs. So really making sure that you're always coming at formulary design and utilization management programs from an overall cost perspective, looking at both medical and pharmacy, essentially looking at the whole patient. First off, really making sure that there's clear policies that are used that really encompass evidence-based medicine and clinical practice guidelines. So when clear policies are out there, such as dosing policies or policies in regard to quantity limits, consistent length of authorization, those types of clear policies can really ensure that the patient and the providers know what to expect and that you're always delivering a consistent benefit across the entire membership. Also, clear transition policies. I think this sometimes is forgotten, that you'll get new members that change plans or new members that maybe have level of care changes, such as a hospitalization or somebody that has moved through different benefits, and really looking at solid transition policies, making sure that there's never a disruption in care. Disruptions in care ultimately lead to, again, a higher cost of hospitalizations and just overall disruptions to the member. So clear and consistent transition policies. Also, really serving as managed care organizations, serving as the center for coordinating care, making sure that they are always looking at all of the information about a patient or a member. It's really hard out there if you're one physician or you're one prescriber or you're one pharmacist at one pharmacy to collect all of the data. And managed care organizations are usually hubs of all of that data. So they have the ability to really look at how to coordinate care and make sure that the member or the patient is getting everything that they need. Another area would be really looking at network and looking at access, making sure your members have access to all the services that they need. And then last but not least is taking that data that I talked about that managed care organizations have and really making sure you have cross-functional coordinated care teams that will assess both social implications on how that's particularly important in the government program space, but they're also just making sure that members and patients have just basic services that will obviously lead to more stable and healthier outcomes for members. Everything coming to the table from all segments of the care team is very important. Examples include the learning from a managed care perspective, the learning of what services are offered in different locations by different providers, as well as the providers of care coming to learn what is going on within the managed care organization. So really, I think it's sort of like a mutual training. Collaboration on policies, using bidirectional information gathering sessions between members, payers, prescribers, managed care, and the foundation, so that all of the care can be understood from all the angles. And I think those collaborative type conversations are really what create the best changes or the best policies that could be out there that will ultimately benefit the members or the patients. I would encourage plans to partner with Hemophilia Treatment Centers, to partner with the National Hemophia Foundation, to really provide cross-training, and it goes both ways. It's training to the providers about what managed care is really ultimately looking at and some of the processes for prior authorization or pre-certification, but then it's also training back from the outside, from the people that are truly on the front line, seeing our members, interacting with our members, and really addressing the challenges that our members have out there that we may not be aware of as we go through our day of working within a managed care organization. So really getting those lines of communication open and kind of strengthening the knowledge base of each other. This, again, is an education piece. It's really about making sure that everybody that's on the care team has access to the pre-certification or the prior authorization information. It's about if there is even going to be pre-certification or prior authorization. There may be areas where some of those limits or restrictions could be lifted for certain providers of care. I'm looking at really defining specialty centers or centers of excellence that if they're seeing your member, you know what their protocols are, and potentially linking that center of excellence or that provider group to not having to have the pre-certification because you have already come to an agreement. You already have a very strong working relationship with that group out there, and they're seeing your members, and you know that your members are being taken care of. And so it certainly would be leveraging a partnership with the Hemophilia Treatment Center and then really creating that comprehensive integrated model between managed care and then all the other providers at the table. So just really making sure that you could leverage partnerships with, I don't want to call it a preferred network of providers or a preferred group of specialty providers that are seeing your members. And then also where there are pre-certification requirements, making sure that those are readily available and accessible out on websites or, through member call centers or provider call centers, really being able to make sure that there's a strong understanding of what those pre-certification or utilization management requirements are. A complete understanding of the services is paramount here. How members have access through the managed care networks, making sure that the care networks understand what all of the benefits of having a hemophilia treatment center accessible for members, making sure that the managed care organizations understand how the hemophilia treatment centers work and all of the additional services that they provide. Really leveraging that ability to have the case management or the care management services rendered to the member, not only from the managed care plan, but in collaboration with the Hemophilia Treatment Center, really partnering. Managed care and Hemophilia Treatment Centers may be providing some of the same services with case management and care management and coordinating care, really leveraging the best of both worlds and getting out there and making sure that there is a true understanding of all of the services at a Hemophilia Treatment Center can have for the numbers in the population that would be covered.